physical trauma, mental trauma, radiational trauma, rubbing, scratching, itching, and at times certain drugs used to control the blood pressure and the pain can trigger this disease, like antihypertensives and painkillers, and certain drug used to treat malaria can also trigger this disease. So always discuss and counsel your patient about these drugs and which drugs they need to avoid the trigger of this disease, right? So after this there is a brief talk or discussion about what are the systemic things or systemic diseases which could be associated with psoriasis. Psoriasis is a predominantly a skin disease, means it affects the skin predominantly, but 1/3 of the patient who have this psoriasis can have their joint affected by this disease. The tissues around the joints itself can get affected, and the presentation known as psoriatic arthritis, means the arthritis which is produced because of psoriasis. Now under this condition, person can get severe joint pain, inflammation, swelling of the various joints of the body, preferably the joints of the fingers, toes, ankle, and the knee joints are commonly affected, or the hip joint can be affected. And this affection of the joints makes person life miserable at times. Mobility is reduced, they suffer a lot, and this needs to be treated along with the treatment of psoriasis. Besides this psoriatic arthritis, there are certain other diseases which can be seen commonly in psoriatic patients. What are those diseases? More commonly in psoriatic patients as compared to a general population. So after that, I like to give a brief description, brief details about the treatment available. Most of the clients ask this disease is related with the body, so how come we can treat a disease which is related with the body itself? Yes, there are treatment available which can make this disease quite manageable so that person can lead a normal life for longer duration. So I categorize the treatment into three parts. One is the topical treatment, means those treatment which comes as a cream, gel, or lotion or formulation, so that they can be applied over the skin to make psoriasis better. So what are these preparations? They can be topical steroid preparation, there can be topical tar preparation, anthralins, vitamin D preparation, desirotines, retinoid preparation. These preparation also helps in controlling psoriasis to a larger extent. Suppose those who have a limited variety of psoriasis, these topical preparation at times are enough for the treatment of such clients. They don't need any oral drug. They can be managed with topical preparation. But topical preparation should always be complemented with a mild soap which should not increase the dryness of the body. An emollient or lubricant or a moisturizer should always be used to control the diseases. So the topical therapy also affects the skin in a nice manner if you use soap and moisturizer in correct proportion. And after that, there are certain therapy known as ultraviolet therapy. Such therapy is commonly 28 days. It started turnovering in 3 to 4 days, means there is a faster turnover in the skin. So that's why you can see a lot of scaling along with redness and itching in such patients. So next thing is how old this disease is for the mankind. It's quite old. It's known since ages. It's seen at the time of Hippocrates. In human written literature, it's known since the 16th century or 15th century. Literature also mentioned the psoriasis. So the disease is quite old. It's known since ages. And if you ask what age group is commonly affected and what is the incidence and prevalence, it's quite variable. But in general, the incidence of this disease, means how many person in a society are affected with disease, is around 2%. Means 2 out of 100 can be affected with disease in India and few other countries. In few countries it's quite less. For example, in Japan, in North America, the incidence is quite low, but it could be more in certain countries. It equally affects the male and females, means it doesn't create any difference in between male and female when it occurs on the body. It's equally seen in both the sexes. And if you ask what age group is predominantly affected, so it's a 20 to 40 years of age group that is commonly affected, means it's commonly seen in second or third decade of the life. But it can affect newborn, it can affect an elderly, it can affect a young person, means any age in between 0 to 1, right from head to toe, but the few areas of the body are commonly get affected. And what are those areas? It is a scalp, ears, around the ears, elbows, knees, and buttocks. These areas commonly get affected by this disease, and at times it doesn't present so typically, means instead of presenting as red patches with scales over the body, it can present as small pus-filled eruptions on the palms and soles, or all over the body, on the nail bed. And at times it presents with very small eruptions. We call them guttate eruptions, which are very dull red in color. Hardly, they don't show much of scaling and much of itching. And at times this disease covers the entire body, and this coverage of entire body by psoriasis is known as erythroderma or exfoliative dermatitis. And under such circumstances it can affect the other body functions, it can affect the life of the person. So that is the most dreadful, or you can say dangerous presentation of psoriasis. When it affects the entire body, then it can affect the internal organs and our metabolites, our electrolytes, our various body function can be affected by this pattern of disease. So after that, I like to highlight more about the triggers which trigger this disease. Means in spite of having a course of the disease in the body, there are certain triggers in our lifetime or in the various phases. Good evening everybody, hope you all are fine and must be enjoying a good health and must be fighting against COVID-19 and must be taking all the precautions to prevent it. I'm Dr. Lakhan Singh Solanki. I'm working as a dermatologist and cosmetologist in Indus Hygiea, a setup located in Phase 6, Mohali, Punjab. And today I'm here to deliver a brief talk or a discussion or a lecture on a topic commonly known as psoriasis. It's a skin disease with joint affection with systemic associations commonly seen in our society and abroad also. So it's called psoriasis vulgaris. People call it psoriasis. It starts with the letter P, Psoriasis. The P is silent, so it is spelled like psoriasis or psoriasis. So what is psoriasis? Psoriasis is a chronic skin disease. It's a chronic inflammatory skin disease. Means you can see redness, inflammation in the skin in this disease. So in this disease, what are the things you commonly notice on the skin of the patient? Patient usually presents with redness, red circular patches covered with thick scales, and these scales are quite thick in nature. They don't resemble the scale that you commonly see in dandruff. They are quite fine and thin, but here the scales are quite thick. So including the redness and scaling, patient often